Speaking to you all today here in New York about TB, it feels a bit like I've come pretty much full circle, because 12 years ago, I was working right here, about a mile away, 345 Park, when I decided that I have to reimagine my life. But why would I leave this glamorous world of 100-hour work weeks, interspersed with the occasional bottle service at the club, to do something as kind of, I want to say, somber, built stiff, and unsexy as TB? Was it the billion lives that TB had claimed over the last 2 centuries? Well, sure, I was a little bit shocked, but not because of the number, but more that I had no idea, had never heard about TB or actually cared about TB before this. No, for me, it was my cousin Thumb, born around the same time, in the same place, to the same family. The only difference is that I had the privilege of growing up in a home that had food and shelter and safety and education and love and hope. Thumb wasn't so lucky. He grew up as a neglected child in a broken home, got mixed up with the wrong people, contracted HIV, and ended up dying far too young. No one knows the exact cause, but as they say, live with HIV, die of TB. And that was the moment when I realized how fortunate I actually really was. Because if I had been born a year later to my uncle's family rather than my mom's family, then it could have been Thumb standing here telling you all about my story. And so that kind of epiphany is what made me feel like, oh, I have to make a change. I have to do something differently. I wanted to run a poll to say, if you guys could guess, which one is me and which one is my cousin? Because that's the point, how similar things actually were and how little control we actually have over them. But so fast forward 10 years and I'm on the phone with Jackie, and she's telling me about reimagining TB care. And I'm like, ooh, can we somehow make TB the next COVID? Or somehow reach deeper into the affected vulnerable communities? Or somehow engage private sector more effectively, like we're trying to do here? Or develop, test, and roll out point-of-care diagnostics better, or tackle TB in the most vulnerable populations? Because all the things you see here are things that epitomize the Stop TB partnership. Things that they've always done. Invest in grassroots, in-country partners, and challenge them to do and fight TB differently. So it wasn't quite surprising when Jackie's response was, yeah, all that, but we need to think bigger. We need to reimagine how we can make the last mile, the first step in everything we do, TB. How we can take our solutions and our products and our designs and make them more person-centered. What that actually means in real life, we've tried to encapsulate in this following video, so please enjoy.
In the fight to end TB, priority setting, policy development, and funding decisions have traditionally been guided and set by global stakeholders and partners. It's time to put countries and local communities in the driver's seat to identify the priorities most important to them and select the solutions that will address their challenges. Thinking beyond science and technology, Friends for International TB Relief, known as FIT, with support from the Stop TB Partnership, sought to identify the challenges facing Vietnam's TB program by first connecting with the people behind the numbers. We sought to deeply understand the barriers and gaps across the TB care cascade through the eyes of TB-affected people, community health workers, healthcare providers, TB survivors, and others. With these transformative goals in mind, the Reimagining TB Care Project, RTC for short, was born in Vietnam. FIT and our partners recently spent 6 months engaging with various user groups to understand their challenges. It's a radically different way of thinking and working, meeting people where they are and engaging them in conversation about their needs and wants, hopes and dreams. Rather than policymakers, implementers, and donors driving the design and decision-making, or a committee of international experts choosing to fund specific interventions, we have formed a local RTC leadership group tasked with deciding the scope and direction of the project. This group is comprised of national policymakers, public and private sector clinicians, local implementers, community representatives, and uniquely, over 20% are TB survivors.
Đây là lần đầu tiên
This is the first time I've seen a project that facilitates close collaboration between TB-affected people, healthcare workers, and policymakers. The enthusiasm we've seen here in Vietnam for this approach is unprecedented. People feel heard, involved, and empowered, making this process feel less like a project and more like a partnership where everyone feels ownership. Before joining this initiative, I often felt that the solutions to TB we had were one-sided and unfair to certain groups of people. With this project, we strive to place people at the center, and the concerns of stakeholders are highly valued. This means a lot to me. The RTC Leadership Group took a people-centered design approach and started the process by listening. In 5 different cities throughout Vietnam, we asked 88 individuals to describe their personal barriers and gaps in accessing or providing TB services, and asked them to imagine how TB service delivery could be different. We conducted interviews with 3 probing, open-ended questions about TB in Vietnam. What is already working well? What challenges currently exist? And most importantly, if you were to redesign the entire TB care process from scratch, what would be your vision? More than 1,500 statements were collected and then categorized into 15 opportunity areas along the TB care cascade. All data were synthesized following a rigorous process that validated results with the various stakeholder groups involved to ensure a people-centered design approach was followed. In June 2023, the RTC Leadership Group was presented with the learnings and insights from the interviews during an interactive forum. They were asked to validate findings and identify any gaps. After much discussion, they reached a consensus on the top priority challenges facing the TB program in Vietnam. The voices of each group member, whether national TB program staff or TB survivors, were weighted equally. 5 opportunity areas were prioritized: advocacy and communications, active TB case finding, financial protection during TB treatment, human resources for health, and data systems. I feel that I am encouraged to express myself here. My experiences and opinions are respected, and I feel that they are valued. After the workshop, a mapping exercise was conducted to identify products that are at a minimum ready to be evaluated or demonstrated in real-life settings, and those that are not supported by other donors or funders. Over 450 products were identified in total, and 19 product categories were shortlisted for Vietnam. The RTC Leadership Group met for a second time in early September to further narrow the shortlist of products using a product prioritization framework co-designed during the first workshop in June. Each product category was assessed for its ability to address the challenges of the TB program and its potential for scale and impact. The group decided to move forward with 3 core product categories: active TB case finding using ultra-portable X-ray machines and computer-aided detection software, tools to differentiate and financially support TB-affected households to reduce catastrophic costs, paper-free data systems to benefit both healthcare workers and TB-affected people. The leadership group conveyed a clear mandate that communications need to cross-cut and support any of the selected interventions. The implementation feasibility of the final shortlisted product categories is currently being assessed. FIT is developing initial work plans and budgets so the RTC Leadership Group can make a final intervention selection by December. Ethical approvals will be obtained, and implementation and introduction activities are slated to begin in mid-2024. This unique way of working will continue for the following 2 years. The RTC Leadership Group will remain engaged to make decisions and ensure the project remains grounded in people-centered design principles, iterate on the selected intervention to improve localization and integration, and measure effectiveness to ensure scalability. I saw the importance of adopting a people-centered design approach in decision-making and initiative selection. Besides placing people at the center of decision-making, it's also crucial to have multi-stakeholder collaboration during the initial stages of project implementation. The RTC project, with its people-centered design approach, takes into consideration people with TB, their contacts, and their community, ensuring that stakeholders are actively involved in shaping and meeting the needs of the community, TB-affected individuals, and their families. The Reimagining TB Care project in Vietnam is not just dreaming of a future without TB. we're actively creating it step by step and innovation by innovation. And together with our key stakeholders and the community, we believe that this future is not just a possibility, it's a promise we're committed to keeping.
Well, as you can see, we're making progress on reimagining TB care in Vietnam. But, you know, when you think about it, why should we stop there? Why don't we reimagine TB policies, or what we've heard earlier from Austin, like TB political will, for example? Or why don't we rethink TB financing and, you know, the points that were made around better linkages with funding or better risk appetite? I really like that one, actually. Or why don't we think about better TB advocacy, youth engagement, as we heard from Siva, and excuse me, and trust, the concept of trust across all of what we do in TB. Thanks to that, Jeremy. Or why do we think about, and this one no one has mentioned, but why don't we think about TB social protection and addressing the social determinants of care beyond what's clinical, you know, like multi-morbidity? But when we go to that step or that level, why do we stop there? Why don't we just reimagine TB? And I want to ask you, imagine, instead of diminishing the scope of TB by labeling it a disease of the poor, we elevate it by transforming it into a measure of the wealth of our nations and the worth of our leaders. Why don't we, instead of accepting this perpetual state of public health emergency for the last 30 years, since 1993, we own and respond to this scathing indictment of our moral complacency and our callous indifference towards the social injustice that is TB? Why don't we, instead of lamenting and bemoaning the empty statistics of helpless TB victims, we celebrate and empower the millions of TB survivors that beat the world's most virulent vector each year? Now, I'm not here to ask any of you to reimagine your lives. Instead, I want to call on all of you to use your positions of influence and your networks of change makers and help Stop TB, or NGOs like FIT, reimagine what our world could be like with no TB. So that maybe by the next TB Innovation Summit 4.0, we can take pride, 4.0, we can take pride in the billions of lives saved from TB rather than lost to it. Lives like that of my cousin Tam. Thank you very much.